Hi, Mr. Johnson. How are you feeling today?
Excited I'm finally getting out of here. I'm going to go watch a Red Sox game on my buddy's new 65-inch flat screen.
That sounds fun. I remember you saying you were from Boston. All right, before you head out of here, I want to explain to you how to use your blood sugar kit one more time. You've had some experience so far with this, right?
Yeah, it's going to be a bummer to have to stab myself before I eat and sleep every day.
Yeah, I wish there was an easier way to check your blood sugar, but this is the best method we have right now.
I understand. Hopefully my blood sugar gets under control after I stop taking the steroids. Let's get started.
Perfect. So I'm going to show you your supplies, and I want you to tell me what they are and what they do.
Sure. Well, that iPhone-looking thing is what checks the blood.
Yes, the glucometer.
Those are the strips I insert into the glucometer, and I put the blood on the strips. And those are the things I stick myself with, the needles.
Yes, you're correct. And don't forget to check the expiration date on the strips. Most last 4 months, but they won't read your blood sugar correctly if they're expired.
Okay. What's the eyedropper for?
Oh, this is for quality control. Before you use your glucometer for the first time, you're going to want to test it out with this. Place a small drop of fluid on a strip, and it should come out with a specific reading. The dropper can expire, so also check that as well.
It's a lot of work. How often do I have to do that?
Every couple of days, maybe once a week, but definitely when you change strips.
Okay.
All right, now what about these?
That is alcohol to clean my fingers with before I poke myself, and the cotton ball is to stop the bleeding.
That's right. The bleeding should stop rather quickly, so you shouldn't need a Band-Aid.
Gotcha.
All right, now let's go through the steps. Assuming you've calibrated your glucometer, you're going to insert the strip into the device, and it will automatically turn on. Then you are going to want to wash your hands with warm water to help the blood circulate to your fingertips. Then you're going to pick a finger and clean it with alcohol and wait for it to dry on its own. Don't blow on it. You with me so far?
Insert the strip, wash with warm water, clean finger with alcohol, and wait to dry. Don't blow.
Perfect. Now when the alcohol is completely dried, you're going to take your lancet or needle and remove the cap. Then you're going to press it against the side of your finger. It should hurt less. Don't forget to wipe off the first speck of blood because it can dilute your sample. After that, you can squeeze a small amount of blood on and collect it on your exposed strip. Wait for the glucometer. If it gives you a reading, then you can place a cotton ball on your finger.
Nice.
All right, to make sure I did a good job of explaining this to you, can you go through these steps again with me?
So after the alcohol is dried, I'll place the lancet along the side of my finger and wipe away the first drop of blood. I'll use the second one to obtain my sugar level.
Perfect. And using the sugar level on the glucometer, you will administer the correct units of insulin using this chart we included.
Okay. So let's say blood sugar is 140. That means I'll give myself 1 unit of insulin.
Yes, exactly.
All right. Well, I appreciate all of your help, Quinn.
All right, do you have any other questions for me?
Nope. Got all down. Am I ready to leave?
All right, let me get you your transport.